All right. Welcome, everyone. So, we are going to get started here in just a minute, but I wanted to say hello. My name is Michelle Grassick. If we haven't met before, I am the host of the Acupuncture Marketing School podcast. And I am so excited to be here today with Robin Ray Green, and we will be talking about ear seeds. Um, thank you for excuse me. Thank you to everyone for being here. And I would love if you pop into the chat just to say hi and let us know where you are tuning in from. That would be great. We have Sarah from Southern Utah, Jane in New Jersey. Hello, hello. And Robin's in Eagle, Idaho. Love that. Calgary, Canada. Hi, Alexandra. Portland, Maine. Jenny in New York. Ashley in Dallas. Walter in Illinois. And Hong in Maryland. Beautiful. Jeffrey in Vancouver. Nicole in Minnesota. Hi, everyone. Amazing. Well, thank you all so much for being here. I just wanted to go over some really brief housekeeping items, and then I will introduce Robin, our guest speaker, and then we can just dive right in. I know she has some slides to share with us and tons of great information. So, just for housekeeping, I think everyone's on mute already, but I would just ask that you double check that you are muted just so there's no distracting background noise while Robin is talking. And I will try to remember to mute myself as well. I have that bad habit of forgetting, and then you can hear me typing. And for the PDA credits, the way that we are going to do it today is to keep attendance. I am going to ask everyone to put your name and your state and your license number in the chat. And that will help me keep track. And I will probably ask people to do the same at the end of the webinar as well, because I'm sure people will join us as we go along in the next couple of minutes. So if you are an acupuncturist and you would like your free PDA credit, just pop your first and last name and your state and license number into the chat. And that is how we are going to keep track of attendance today. And you are always free to email me with questions about the PDA credit as well. Yes, and Michelle says that you've registered with that info already. If you did, that's fine. I only turned on the request for the acupuncture license and state in the past couple of days. Otherwise, it was mostly just collecting people's name and their email. So if you haven't already provided that info, you just want to make sure that you do that so I can give you your free PDA credit. Thank you, everyone. All right, so let's dive right in. And I'm going to introduce Robin, and then I will make her the host and we can get rolling. Where are we here? Whoops. There we go. So, welcome, Robin. Thank you so much for being here. It is my absolute pleasure to introduce everyone to Robin Ray Green. She is a pediatric acupuncture expert, an author, a speaker, and a business coach. She's retired from private practice and co-founded Thrive Ear Seeds educational platform and the Ear Seeds Mastery certification to help make auriculotherapy more accessible and easy to learn. So her knowledge, she's so generous with the way that she teaches, which is why I'm excited she's here today. And her information that she teaches is grounded in real world experience with the goal of bridging the gap between traditional practice and the needs of modern patients. So today, Robin brings us her expertise along with her really heartfelt stories and solutions to using ear seeds and integrating them into our acupuncture practices. So I am really excited to learn more. Let me make you the host, Robin. Thank you so much for being here.
Thank you so much for that wonderful introduction, Michelle. I'm really excited to be here. I really had so much fun putting this presentation together, so I'm really excited to share it. And I'll go ahead and share my screen here.
Perfect.
All right, so we're going to be talking about how acupuncturists can integrate ear seeding to build their practices and improve patient outcomes. And how ear seeds, what we'll cover today is how ear seeds can enhance your treatments and improve clinical outcomes. And by the end of our time together, I'll be showing you how you can also use ear seeds to help grow your practice in a fun and easy way. And I want to invite you to stay to the end because I'll be giving away an ebook called Unleash the Power of Shen Men to all attendees. And it has everything you need to do a successful Shen Men demo, including checklists, templates, signage, and so much more. And for those that are ready to take the next step, I will be sharing with you all about our certification and how you can get this beautiful auricular poster for free. And we have some amazing specials that you'll definitely want to check out. So let's get in the zone. Let's get super focused. And I have a ton of great information to share with you today, and I don't want you to miss out. So close those tabs and turn off any notifications. And you are in the right place if you know your patients would heal faster if they could manage stress better. I don't know, a lot of our patients have a lot of stress in their lives. And you're also in the right place if you're curious how ear seeds can enhance your acupuncture treatments and help your patients reach their health goals faster. And you're in the right place if you'd like a simple and fun way to grow your practice and keep your schedule comfortably full in a way that's super aligned and creates curiosity, builds relationships, and helps you book new patients. This is all possible, and ear seeds have the potential to transform your practice and your patient outcomes. And they're more than just an enhancement. They're really a game changer, fast tracking the healing journey itself. And when you master ear seeding, it's not just a part of your practice, it's really the heart of it, a standalone tool that supercharges your treatments, elevates patient outcomes, and revolutionizes the way you go your practice. So today we're going to cover how ear seeds can enhance your treatments, the science behind auriculotherapy. So we're going to dig in a little bit into the role of the vagus nerve regulation and cell danger response. We're going to talk about how ear seeds can actually improve clinical outcomes and the steps you want to take with them to do so. And then we'll wrap it up with how to use ear seeds to build your business or your practice. And then we'll follow that up with a Q&A. And I am so proud to be an acupuncturist and have written several books, including Heal Your Child from the Inside Out. And you know, this ear seeds actually became very personal to me because it was a major part of my recovery from mold illness. And when I moved to Idaho in 2019, the house I lived in had mold, and I got very, very sick. And ear seeds were a huge part of my recovery. And you'll see why as we get into the science behind how they work. And so this really inspired me to partner up with my dear friend and colleague, Ellie Goldschmidt, to create the Thrive Ear Seeds educational platform and the mastery certification. And our mission is to empower health professionals to incorporate ear seeds into their practice, expand their impact, improve patient outcomes, strengthen their businesses while having fun and also making a positive difference in people's lives. And our approach really emphasizes service, collaboration, and community, and we strive to create a supportive environment where practitioners can grow and thrive. So let's go ahead and dive right into today's topic. So first of all, how exactly can ear seeds enhance your treatments? It really boils down to what ear seeds can treat and the physiology of how they work. Whether you're using needles or ear seeds, both have a very important role in healing, as you'll see. And according to the World Health Organization, auriculotherapy can treat over 150 conditions, and they can treat everything from stress, anxiety, weight loss, hypertension, tinnitus, that's a really big one right now, dizziness, vertigo, all kinds of pain, hormone imbalances, PMS symptoms. So I'm just wondering, for those attending live, what conditions are you already treating that you'd like to add on a layer of additional support for, right? Let me know in the chat. I know for me, ear seeds helped children tremendously with anxiety, hyperactivity, sleep, focus, attention issues, autism. Ear seeds were always my first go-to when working with kids because it really calmed their nervous system down before we did anything else. And it was amazing. Let's see, Brandy says ADHD. Michelle says tinnitus is really, yeah, tinnitus is really hard to treat, and ear seeds are amazing for that. We can talk about that at the Q&A if you guys are interested. Anxiety, pain, CPRS, yes. yes, ear seeds, fantastic for these conditions and offer a really intriguing and really powerful layer of support. Restless leg syndrome, Parkinson's, yes, you guys all, ear seeds are going to be amazing for all of these conditions. The reason why they have a balancing effect on the nervous system is by stimulating the numerous nerve branches on the ear, specifically the vagus nerve. In fact, the only place where the vagus nerve reaches the surface of the body is the ear. And I'll share the physiology of how this works shortly. But in a nutshell, vagus nerve stimulation turns off the body's stress response, and stress can be emotional, it can be physical, it can be from latent pathogenic factors such as infections, mold exposure, environmental toxins. And what stimulation from auriculotherapy is doing is telling your body that you're safe. You can exit survival mode. And this helps our patients enter what I call healing mode. And we know that when our patients are in a parasympathetic dominant state, the body is dialed in to heal. We also know acupuncture has this effect, but the challenge is helping our patients remain in healing mode in between sessions, right? How many of our patients have had an amazing acupuncture treatment? They feel utterly relaxed. Their symptoms are better. They're feeling great. And then bam, they head straight out into rush hour traffic, or they're running their kids around after school, or they have a fight with their spouse or partner, or there's something stressful going on at work, right? And these stressors put them right back into a sympathetic dominant state. And so acupuncture can help them enter healing mode, and ear seeds can help them remain there or re-enter healing mode by providing that mild, continuous acupressure on the auricular points, regulating the vagus nerve. And another example is, is that ear seeds have been adopted by fertility specialists, including our very own Dr. Susan Fox. And she says auriculotherapy for improving IVF transfer outcomes has been in place since 2002, when research demonstrated statistically significant improvement in IVF outcomes when using ear points immediately prior to and following an IVF transfer. So really amazing stuff. So let's take a look at 6 ways ear seeds can enhance your acupuncture treatments. So the first is that it can expand your scope of treatment in many ways, allowing you to treat multiple conditions at once with fewer needles. You can target corresponding body parts on the ear and send messages of homeostasis or healing just by adding on ear points. If your clients cannot be prone for any reason, like let's say you want to give them a back treatment, but they can't do that. They need to lay face up. You can treat back pain and inflammation on the ear while giving them a face up treatment with maybe the, oh my gosh, it just blanked. The, anyway, the other systems of acupuncture, we can use the channels and all of that to address the back, but we can very specifically target the back through the ear. Sometimes patients have sensitive areas where they don't want needles at all. So you can also target those areas on the ear instead. And then, we can avoid intrusive points, right? If the patient has issues like genital issues or hemorrhoids or something, a similar complaint, you can address it on the ear in a completely non-invasive way. And then finally, ear seeds, even if you're not a pediatric specialist, you can still deliver a really beautiful treatment on a child using ear seeds. So that's just one way. It can expand the scope of what you treat. And the second way is by using auricular diagnosis, you can observe the internal workings of the body in order to discover and address root causes. And I had one patient come in that had a chronic cough, and after looking at his ear, I saw this protrusion right here in the stomach area. And it made me ask, like, do you have anything going on with your stomach? Do you have acid reflux? And he was like, no, I don't have acid reflux. And I was like, I wonder if this cough is coming from like a silent reflux, right? Where they don't have any heartburn symptoms, but they are still having reflux. So I had this hunch. He went to the doctor, and it turned out that he did in fact, have silent reflux. And sure enough, the ear helped us discover the root cause. And then I was able to develop an effective treatment protocol instead of chasing the symptoms. And then number 3, auriculotherapy has been clinically proven to lower elevated cortisol levels and help them remain low for days after. And elevated cortisol, as I'm sure you're all well aware, the long-term effects are associated with many chronic and degenerative diseases. And this is super important in the healing process, is getting cortisol levels balanced in the body. And then number four, ear seeds can balance the nervous system by regulating the parasympathetic and sympathetic nervous systems, bringing them back into a balanced state so our clients can enter healing mode faster, remain there longer, and even re-enter a balanced state by stimulating their ear seeds throughout the day. And number five, ear seeds can be worn for up to 5 days, so we can extend the time our patients remain in healing mode and continue to send messages of homeostasis to both address symptoms and root causes. And this will help speed up time as well. And many of us, our clients have a lot, or our patients, they have a lot going on, right? They maybe have multiple conditions, they have autoimmune stuff going on. And a lot of times we've got to get them some relief from the immediate symptoms. And auriculotherapy is a great way to do that so that you can then go and work on those root causes, which take a lot longer, right? You may need to change the diet. They may need to take herbs. They may need to do other things. And ear seeds can be a really great way to provide relief. And we see this a lot with like menopausal women with hot flashes where, they just need some relief from the hot flashes, and then they're motivated to do the deeper work to nourish their yin and clear out that heat that takes time to do. And number six, with our expert guidance, auriculotherapy with ear seeds is a modality that our patients can apply at home and during travel and for urgent symptoms, right? None of us want to be on call 24/7. And sometimes our patients have urgent things, and ear seeds can be one way that we can provide a solution in between the time it takes to get them into our office for a visit. And one of the concerns I often see with acupuncturists is like this fear of allowing patients to do this themselves at home, that like suddenly it's going to replace acupuncture, or they won't be committed to their plan. And actually I see the reverse. When we help them get some relief immediately, whether it's from ear seeds or a combination of ear acupuncture and body acupuncture, it actually has the opposite effect. When people feel better, and whether it was from the ear seeds or the acupuncture or combo, they're more committed than ever to their overall treatment plan because they've seen that you're going to help them get results. And then they want to work with you. And it actually helps build trust with your clients. So these are all the amazing benefits of adding ear seeds and how they're enhancing treatments. But I want to make sure that you avoid one of the most common mistakes, I think, that can happen with acupuncturists. And I don't know about you guys, but I did not get a ton of training in auriculotherapy when I was in acupuncture school. It was kind of like jammed in with color puncture and Tibetan medicine and a whole bunch of other modalities. We spent about a few hours just learning the concha and some of the functional points. And so as a result, I felt like, at least in my, with my colleagues, that some of them were just sort of treating it like it was a throwaway treatment, just something, this modality is just throw it on at the end as an extra, giving patients the impression that ear seeds aren't valuable or that they're sort of an afterthought instead of a modality that actually is a standalone treatment, right? The reality is that there are many health professionals out there, from medical professionals, all different backgrounds, that are using ear seeds and auriculotherapy as a standalone treatment, and they're charging anywhere from $50 to $80 a session just for auriculotherapy. And it takes time and training to be really good at creating customized treatment protocols, correctly locating the points, and doing auricular diagnosis. So my advice is never to just like rip off a strip and just give that, to your patients for free. Because ear seeds it's such a valuable service. And as you'll see as we get into the science, how it has such a profound effect on the body that you never want to give it away for free. And my hope is that by the end of the class, you'll see that ear seeding is an effective standalone treatment and a really, really powerful combination with acupuncture that's going to enhance your treatment and have a greater impact on your patients, and that you're charging accordingly, so that the true value of this service is you're being, compensated for that. So let's go ahead and dive right into the science behind ear seeds, the vagus nerve, and cell danger response. And I think when I explain this to you, hopefully you'll love auriculotherapy, probably even more so than you already do right now. So, as you know, auriculotherapy has been around for thousands of years, but it took a quantum leap forward in the 1950s when French physician and neurologist Dr. Paul Noget, he developed the somatotopic map of the ear with the organized distribution of most of the auricular points that we use today. And it was through his extensive research that this ear map was created. And then further research on this map was done in China by the Nanjing Army of Auricular Acupuncture, which validated his findings and also made major contributions to the ear map. So Noget discovered that the ear is a microsystem of your entire body, as represented by the upside down baby image, which lays the groundwork for the distribution of auricular points. And the map contains hundreds of points on your ear that correspond to various body parts. And in fact, every body part has a corresponding part on your ear. And then TCM doctors added important contributions like Sanjiao, Windstream, Shen Men, and they also added their own locations for the spine. And that's why you'll see some different locations for the Chinese and the European systems. And we teach a combination of these different systems in our certification. And I believe you can really comprehensively use Western anatomy and physiology and Chinese medical theory when you select your points. And the combination of both works best because it's the most comprehensive way to create a treatment protocol. And the reason why auriculotherapy and ear seeds work is because the ear has a direct connection, a direct communication channel to your brain and your nervous system by way of nerve branches. Both cranial nerves and spinal nerves make your way to your ear, forming the unique auricular microsystem. And in fact, as an embryo is developing, the ear develops from a protrusion from the brain, which is why that connection is there and it develops, during, our fetal development. And you can see the complete nerve innervation throughout your ear in this image. And this green area here has a strong focus on the vagus nerve. And this is really amazing. And you'll see why on the next slide. The vagus nerve is your 10th cranial nerve arising from your brainstem over here. And it is often referred to as the wandering nerve because all of the organs that it affects. And one of the most important functions that we just discussed is to turn off the body's stress response and activate the body's relaxation response, shifting the body from that sympathetic dominant state to a parasympathetic state. And you'll see why this is so important when we get into the cell danger response. But in addition, you can see from this image how many organs it impacts, right? The heart, the lungs, the liver, gallbladder, adrenals, the reproductive organs, the intestines, the stomach, the esophagus, so much more, right? So many areas that the vagus nerve innervates. And then if we look over here at this up close chart of the concha of the ear, you'll also see how many corresponding body parts are innervated by the vagus nerve, right? So you see these connections. And the vagus nerve is super, super important for healing, and it all has to do with the cell danger response. Now, Dr. Robert Navia, a professor of genetics at the University of California, San Diego, has conducted extensive research on the cell danger response, or CDR. The CDR is this protective response that cells use against danger, such as injury or infections or toxins or stress or even psychological trauma. And as you can see from this slide, the cellular and metabolic processing of CDR are quite complicated. But simply put, there are 4 stages of CDR, or cell danger response. And for full healing to occur, the cells must move through each stage. And if this process gets derailed at any stage or stuck at any stage, specific types of symptoms can emerge, and then it can be difficult to achieve full healing. And this explains sort of the epidemic of chronic illness that we're seeing all over the world, especially in the United States and so forth. Think asthma, eczema, chronic fatigue syndrome, fibromyalgia, autism, heart disease, autoimmune conditions. These are all examples of CDR that is stuck. And this brings us back to the vagus nerve because it is also involved in activating CDR's final stage here, which is critical for full healing to occur. The key here is that the autonomic nervous system, or ANS, needs to maintain a balanced state, right? The vagus nerve gives the body the safety signals so it can go into healing mode and achieve that balanced ANS state. And this must happen for a long enough period of time that the body can actually finish this CDR cycle here. And according to Dr. Navia's work, he says that takes about 90 days, right? That's why, coming back to the ear, I think auriculotherapy and ear seeds are so important because they're such an easy, effective way to activate the vagus nerve, heal at the cellular level, and they make a great addition to acupuncture. And even more than that, there is a growing body of research that's showing that transcutaneous auricular stimulation alone can help with many different conditions, including migraines, cognitive impairment, musculoskeletal diseases, depression, and so much more. I literally could not fit all the studies on this slide. This is just a handful of the ones that are showing. Okay, so now we know the vagus nerve is super important to healing. It helps the body complete the healing cycle, the stages of CDR, and we want our patients to remain in healing mode for about 90 days to allow the full healing, the full CDR cycle to complete. But it gets even better. And this is, to me, is the most fun part of auriculotherapy. So stimulating the ear, as you know, can send messages of homeostasis to the corresponding body part. And the inverse is true as well. Body parts can send messages back to the ear, creating auricular signs, letting us know something is going on with the body that needs attention, just like that case I shared with you about the acid reflux, those silent reflux creating this person's chronic cough. So say yes in the chat if you guys want me to show you what auricular signs to look for. So the vagus nerve signals are a two-way street. We can stimulate the ear and restore balance to the corresponding body part, and that body part can also send you a signal in your ear letting you know that something needs your attention. Okay, so you guys are saying yes, you want to know what these signs are. So let's talk about what signs are going to appear on the ear. The main things you're looking for on the ear are discolorations, protrusions like bumps, which would appear as swellings or nodules, indentations, prominent blood vessels. You can see a lot of this on this ear here. And you could also see white flakes that almost appear like dandruff, as well as lines and grooves on the ear. And every type of auricular marking is important, and the indication depends on its location, its color, and if it's a line or groove, the angle is also very important. The auricular indicator, the sign, could mean some health issue is going on right now, or it could be an indicator of a past health issue or trauma, and your ear decided to hold on to that record. And sometimes it can be a warning sign for the future. So just like with pulse and tongue, we might be able to see issues before they even arise and become symptoms. So let's look at some examples. Discoloration, no matter what color your ear is, a light-skinned person, a dark-skinned person, you can always see a change in color at a certain area when you compare it to the rest of the color of that ear. For example, you may see a red, brown, or white discoloration. I think this is actually the area of discoloration here on this ear. Somehow that little circle got moved, but that's the area of discoloration. You may see protrusions and swellings, and that could be in the form of nodules, papules, bumps on your ear, and they can be large ones, like the ones shown here, and they can appear quite small, as you can see in a couple of these images. And you may see indentations or depressions, and that's like the opposite of a protrusion. And the meaning of protrusions and indentations depend on the location that they appear on your ear. Now, blood vessels, you can look at some ears and not see any prominent blood vessels at all. And then in other ears, they're clear as day. Blood vessels are very common indicators of pain and trauma. And then here's some lines and grooves on the ear. They could appear in several places, and each line or groove has a specific meaning based on their location and the angle of the line. In fact, in the 1970s, there, oh gosh, what is his name? Dr. Frank. Um, they called it Frank's sign, and it was a sign on the ear at about a 30-degree angle that is indicative of potential heart issues. So medical doctors have been using auricular diagnosis to, check their patients for potential heart issues. So here's an example. So my business partner, Ellie, was doing an ear seeds show. And after applying ear seeds to this woman, you can see her crystals that he put on. He sees these prominent blood vessels right in this area, in the knee area. And, he's kind of shy. And sometimes he was like, well, I'm seeing some blood vessels in your knee area. And he asks her, do you have any issues with your knee? And she was like very bold and just pushed aside her skirt and showed him that she had just had knee replacement surgery. So you won't always see auricular signs on the ear. Like somebody could have a knee surgery and not have prominent blood vessels or redness in the knee area. But when you do see the auricular signs, they are pretty accurate that something's going on. And if you find this fascinating, we cover this in depth in our Ear Seeds Mastery certification. So those are the signs to look for auricular diagnosis. Now let's discuss how you can integrate ear seeds to improve outcomes. So step one is you want to formulate a custom protocol for each client. Most of us were taught corresponding points and functional points, right? So, they have back pain, you're going to do back points. You might do something like Shen Men or thalamus to address pain, right? And for a lot of people with non-complicated issues, that may be enough. But as you see more complicated cases or you're working on multiple conditions at once, there's a 5-step process that allows you to more fully address the unique needs of your client by integrating into things like Western pathophysiology, Chinese medical theory, auricular diagnosis, and then research or clinical experience to formulate a concise, very directed treatment protocol for that client. Another aspect of ear seeding that can improve clinical outcomes is auricular diagnosis. Like you just saw, the ear can provide so much information. And a lot of times our clients will omit useful information because they don't think it's relevant, right? And auricular diagnosis can be a really helpful assessment tool that can help you ask the right questions about your client's health and even help you pinpoint root causes. Like one of our practitioners was trying to figure out what was going on with her daughter's abdominal pain. So she posted a picture of her daughter's ear. We could see right away redness in the stomach area. And when she went to the doctor to have, investigate this further, the doctor diagnosed her with a stomach ulcer. So the ear was pointing towards the stomach as a cause of pain she was feeling in her abdomen. An auricular diagnosis can also help with precision point location and help you formulate your treatment protocol. But I think for me personally, the most fun part about auricular diagnosis is that wow factor that it adds. It's really impressive for your patients when you can tell something about their health just by looking at their ear. And this alone helps your patients build confidence and generate referrals. And number 3, since the autonomic nervous system and the vagus nerve are so important, I wanted to share points that have a balancing effect both on brain activity and the overall nervous system. And you can test these points for reactivity and include 1 or 2 to help regulate the vagus nerve as part of your customized protocol. So I wouldn't put all of these points on a patient at once, but if you're trying to balance out the sympathetic and parasympathetic nerves, you could use sympathetic and point 0. But I recommend testing for reactivity, whether you're doing pain point testing or you're testing the electrical conductivity with a point detector or something like the Point O Select. That can help you really hone in on the right balancing points that particular client needs. So number 4 is to stimulate the points daily. And this goes into really ensuring that our patients remain or re-enter healing mode. So we want them to be stimulating the points on a regular basis, unless the points are so sensitive that they can feel them without the extra stimulation. A lot of times, the ear will feel really tender. Like, let's say, back pain as an example. Actually, I'm wearing an ear seed right now for my neck. My neck's been bothering me, and I'm very aware of this point right here for, the neck and cervical spine. But the other ear seeds that I have on my ear, I don't feel at all. So having your patient stimulate the points 3 to 5 times a day is going to add extra stimulation to the nerve branches to continue sending those messages of homeostasis and help the body remain in healing mode so they can complete the healing cycle. And then we also want to support the cell danger response and make sure that they stay in healing mode long enough for the cells to complete all 4 phases of CDR. So instructing your patients to wear ear seeds for 5 days on, 2 days off, which is considered one cycle for up to 12 weeks, is going to have the best outcome. Of course, you as a practitioner need to make that judgment call in your office, like how long. Some clients may only need to wear them for a couple weeks, some may need to wear them for the full 12, and a lot will need to wear them some amount of time in between there. And so you can obviously alter this cycle to fit the needs of your client. And the reason why we say 5 days on, 2 days off is just to make sure that the ear can have rest to reinvigorate itself. But some of your clients may not want to remove their ear seeds because they help so much with their symptoms. So in that case, I usually just have them alternate points so that the particular area of the ear that you're working on gets a chance to rest before another ear seed is applied. So let's just recap. The ear seeds improve clinical outcome by helping our clients manage stress, reduce anxiety, lower cortisol levels, balance the autonomic nervous system, and then the body can enter into healing mode. And when the body is back in that parasympathetic dominant state for long enough, it can complete the CDR phases and finish healing. And when you put it all together, there are many advantages to ear seeding. You can use it as a standalone treatment, especially for children. And once you know what you're doing with auricular diagnosis and ear seed applications, it's quick and it's fast, it's easy to apply. And because so many patients notice a difference, then you find that compliance is really high. Most of my clients requested them. If for some reason I forgot them, my patients always ask for them. And so I think compliance is really huge, especially for helping them maintain in between sessions or during travel. And it's pretty easy to get started. In fact, you can get pretty good results with just a handful of points that I showed you today. Although, most health professionals really want to dive in and use the full breadth of this modality once they get a taste for how well it works. For example, Diana shared her success in treating a 3-year-old with sleep issues. And the mom reported that after ear seeding, her daughter was able to go to sleep with ease. And, ear seeds are just so powerful for kids in balancing the nervous system, not just for sleep, but for many other conditions. But ear seeds can do so much more than improve clinical outcomes, which alone is going to help generate referrals. So let's talk about the business strategies surrounding how ear seeds can help you grow your practice and increase your revenue. And there are 6 main ways ear seeds can do this. So number 1, you can diversify your offerings and earn income for more than one service, which means you might start seeing patients that wouldn't necessarily come in for acupuncture, because we know there are people out there who are like, needles are just not for me, not going to do it, but they would come in for ear seeding because it's non-invasive and no needles are involved. And you can do individual sessions, or you can do ear seeding in a group setting, or even at different venues. And we'll talk about that in a little bit. So when I got to a point in my practice in Morgan Hill where it was full, I had a wait list. And so if a patient had an urgent, thing going on, I would actually invite them in. I had 3 treatment rooms, and while I had 2 going, I had one where I would just do auriculotherapy. So they would come in. I had a lot of patients that came in for auriculotherapy sessions for anxiety and pain in between their regular acupuncture sessions. So, and auriculotherapy honestly is a great gateway treatment to people becoming acupuncture clients as well. And then you can earn extra revenue by charging for ear seeding as an add-on service. And I'm not talking about just like popping on Shen Men and being, that's it. I'm talking about an actual full protocol where you do auricular diagnosis, you're testing, you're finding the tender points and creating a customized protocol. You're doing auricular diagnosis as well. And if you do this, I recommend just keeping a simple pricing structure that's say somewhere between $20 to $30 for ear seeding, includes as many points as needed, and say up to 4 crystals. So you want to price it so that like you're not charging per seed and you're taking into consideration your time, expertise, and cost for adding this additional layer of healing onto your acupuncture session. And then you may find that you want to use ear acupuncture and ear seeds on all your patients. It's just a non-negotiable. Every patient gets either ear acupuncture and or ear seeds as part of their treatment. And with the added value of this service, you can and should raise your fees, which will increase your overall income. And that's ultimately what I did back in 2018. I raised my fees. Everybody got ear acupuncture and or ear seeds. And then the only thing I charged extra for was if they wanted crystals instead of like gold or vicarious seeds. That way I just, covered my extra costs there. And number 4 is ear seed demos. I cannot stress how fast ear seed demos can help you grow your practice because it's so aligned with your services and you can share it and you can give it away during a demo without ever devaluing your acupuncture services. You can offer internal events at your office if you want to reconnect with past clients and book new ones. You can go to external events like wellness expos, lifestyle, holistic lifestyle events, and do free demos and paid auriculotherapy services right on the spot. And as a part of our Ear Seeds Pro Club, I've been coaching acupuncturists and health professionals for a couple of years now. And ear seed demos really make booths stand out when compared to offering, like trying to get people to come and talk to you about acupuncture. And it's almost like when people see a booth for a chiropractor or an acupuncturist or some kind of service, they know that ultimately you want them to come in and become a patient. And it's sort of kind of, people can be a little bit repelled by that, right? Only the people that are really interested are going to come up. And a lot of people can have like these knee-jerk reactions to acupuncture, right? Like, oh, needles, gross, like I can't, and whatever. But ear seeding is it really sets your booth apart because it creates curiosity. When people see, with like if you're giving away like 1 crystal ear seed on Shen Men or tranquilizer, it literally attracts people to the booth. They want to see what you're doing on that person's ear. And people sometimes have amazing reactions to ear seeds almost instantaneously, right? They can feel like their back pain go away. They can feel their stress levels come down, whatever, however you want to do it. And recently, one of our practitioners just made $500 in like a couple of hours at her latest event, just doing basic protocols. So she was giving them, offering them a free demo. Hey, come here, check out these ear seeds. That attracted people to their booth. Once people start getting it, it attracted more people. And then it's hard to get that first yes, right? The first yes is the hardest part. But once they say yes to the free demo, they're more likely to say yes to a full protocol. And then as you're giving them the full protocol, you're evaluating their ear, you're talking to them, you're building rapport, and they find out, oh yeah, you're an acupuncturist as well. And oh, that back pain, you help people with back pain all the time. That leads into them becoming a patient for your main service. So a lot of our practitioners will do events for a few hours. And then what happens is they get emails, they get phone numbers, they get, hands-on people. They build rapport. They not only make money at the event, but then they end up booking a few people for their main services. And as you know, a client with a chronic issue, that could lead to thousands of dollars in revenue alone just by getting those new clients in. And our, practitioners usually have so much fun doing ear seed demos because they never have to, there's not that awkward moment of trying to explain acupuncture. We just get them in and then we talk about the ear seeds and then the rest sort of happens organically and naturally, which is great for those of us like me who I'm an introvert. And, it's so much easier for me when people are asking me the questions and trying to you know, convince someone to come in for a session. So you can give free ear seed demos without ever discounting or devaluing your main services. For example, Dr. Melissa Durfee, she is in a growth phase of her acupuncture practice. And with ear seed demos, she's already becoming the go-to expert for ear seeds. And then people are coming in for her skincare, her self-care, and her acupuncture services as well. And then Brandy is another great example of the power of demos. Like many health professionals, she has had to start over after the pandemic. So she did ear seed demos at her first open house. She didn't have a ton of attendees. I think she had like 5 or 6 people come. And she booked 3 new clients from doing those demos. And I know Brandy followed the advice in our ear seed book that we promised you called Unleash the Power of Shen Men. And we'll be sharing that link to the book so you can download it shortly. And number 5, ear seeds are noticeable. So your patient's ears will become a billboard for your practice. All of my patients at my acupuncture practice in Morgan Hill got ear seeds, right? They had their crystals, they had the vicarious seeds. And so the local doctors, like the chiropractors and the PT guys and the pediatricians, they all knew who my patients were because they were wearing ear seeds. Now, I was in a relatively small town, and I'd been there for a long time. But it's such a noticeable thing that it actually led to several direct referrals from other health professionals because the ear seeds got my client, our mutual client, talking to that health professional about me and how I helped them. It helped keep me top of mind. And then that led to referrals and like creating this referral network from other health professionals in my local town. And then number 6, with all the media attention ear seeds are getting, the industry is growing fast. And, like year over year, ear seed sales are going up and up. And, your patients probably already know what they are or have heard of them. So make sure that they're buying them from you because you can create a custom protocol. You can ensure that they're getting the highest quality latex-free products. And you don't have to sell them like a whole kit with, a ring of cards or anything like that. You can sell them. You can see on the back of this picture, this is what they called a simple singles. It's just 20 ear seeds in a professional package that you can sell to ear seeds. So never, rip off the ear seeds and just hand this to your client for free. Get a series of these simple singles, and then you can, create a custom protocol with a chart like this for your client where you are overseeing their care. And then they're coming back to you at every session and saying, okay, you can adjust and monitor their protocol as needed. And a lot of times what happens, our patients love it for anxiety or pain or whatever we're using the protocol for. And they start asking, well, can you put ear seeds on for sleep? Or can you put ear seeds on for this? Or could my son use ear seeds for that? And then that can lead to more referrals. So don't ever be afraid that selling ear seeds are going to replace you or replace the need for you to direct them in their care. And the honest truth is like 95% of the people out there do not want to put these on themselves. They have a hard time finding the points. They're like, I'm not sure if I'm doing it right. And they would much rather let you do it. But if you have some ear seeds that they can use at home, they can replace ear seeds if they fall off or if they get too painful to wear overnight. And then, you're the authority, giving them the protocol and adjusting it as needed while also increasing your revenue through another, stream of income from ear seed sales. So can you guys see now how powerful ear seeds are? Let me know in the chat. Can you see how they can revolutionize your practice and help you have greater impact? Ear seeds are just so near and dear to my heart. I'm seeing lots of yeses come through. Ashley says yes. Michelle says yes. Suzanne, yes. Michelle says they love that they can help with difficult conditions. Hong says yes. Brandy says yep. So I hope now you probably already were a fan. That's why you're here. I hope now that you are a super fan. So I have another question for you. Would you like us to help you master ear seating and elevate your practice? If you would be interested in that, I can just share you briefly where you can get that information here. Mark's saying definitely yes. Cindy's saying yes. Michelle says yes. Awesome. Okay, so I want to invite you to join our Earseeds Mastery Certification. You can check it out over at earseedcertification.com. Michelle will also pop in a special link in the chat as well. And if you use code ACU150, you will get $150 off the certification now through May 12th at 9 p.m. Pacific. And in addition, if you sign up before May 12th, we will also send you this beautiful auricular poster. Um, and it's a $48 value. It has all the auricular points on it. And be sure to use that coupon code ACU150 so you can get that and $150 off of our program over at Earseed Certification, or just click on that link that Michelle put in the chat. So we would love to have you in. I know for me as an acupuncturist, like I learned the concha, I learned the basic points, but what really sets our program apart is we go through the ear zone by zone. And instead of trying to just sort of eyeball where the points are on the ear, we actually give you those anatomical proportions and locations of like how to divide up the ear to find the point, how to test to make sure it's the right point, how to bring it all together with auricular diagnosis. And, the auricular diagnosis piece was something I learned from Ellie, from my business partner, and it has been huge. So anyway, we cover all of that in the program. We would love to have you. Be sure to check it out. And then I wanted to give you, drop the link for you to get the Unleash the Power of Shenmen ebook that we promised you. It has complete instructions on how to do a Shenmen demo, where to do it, how to do it, what you need, what you should say, checklists, signage, and more, so that you can host a successful Shenmen demo event, book, and give full auricular protocols right there, and then lead into booking new patients. So Shenmen is just such an amazing point that it can be used as a real amazing practice growth tool, and all the keys for, all the key information you need to know to do it effectively are in our book. So highly recommend checking that out. And I'll go ahead and stop sharing, Michelle, if there are any questions.
Thank you so much for that. All
Oh, you're
right.
so welcome.
Yeah, I learned a ton. I did not see a lot of questions in the chat, but I have a couple questions for you.
Okay.
And I apologize, everyone. The first link that I put in the chat, I don't think that link was actually clickable. So I just put it in again, so that should work better. Let me double check and see if there were any questions that I missed. It doesn't look like it, but if anyone has any questions, you are more than welcome to pop them in the chat, and I'll start with my questions and then we can see if anybody else chimes in. So something that I wanted to clarify, because I learned a little bit about ear seeds in school, but nothing to the level of detail that you are talking about. And I love the diagnosing and knowing, like tongue and pulse, what questions to ask people based on how the ear appears. So you said that the increased blood vessels in a specific area can indicate it's like on top of the potential area of pain. So like if it's on a specific joint area or organ, then that's how we know where to ask questions about that.
Right, exactly. So, like, a patient's coming in and they say they have abdominal pain, and you're observing, you could see a protrusion in the stomach area. You could see, like with patients with diverticulitis, I've often seen little prominent veins in the small intestine area.
Gotcha.
For
Okay.
people with ulcerative colitis and Crohn's, I've seen entire redness around the U shape of the helix crus. And
Okay.
so it gives me a really good idea of like what organs specifically I need to target, both with ear seeding and then with acupuncture as well.
Gotcha. Okay, amazing. And then the other thing I wanted to mention is not a question so much as to share with you that my acupuncture associate at my office recently started using the crystal ear seeds, and she shared a video of the seeds on her own ears on Instagram, and she got two patients right away. And this was a couple weeks ago. So we were speculating. We were like, man, what is it about sparkly things that it's like people could ignore your Instagram account for weeks and weeks, and then you put something sparkly on there and they're like, oh, what is that? So that was very exciting. And I see we have a bunch of questions. So the first one is from Sarah. Whoops, and we just got another question and pushed it up. So can an RN certified in AAT do this as a standalone practice?
Um, well, here's the great news. With auriculotherapy using a non-invasive technique like ear seeds, there is no board certification, so you absolutely can do it non-invasively as a standalone practice. And we have many people that are doing that. We have I'm not suggesting anybody has to do this, but we have quite a few acupuncturists that had to close their practices during the pandemic and are reopening, starting with just doing auriculotherapy because the startup costs are so low and it's so easy to get patients in this way. And as they're, building this practice, then they're going back into opening their acupuncture practices that way. So it can be a really great kind of conduit for reestablishing your practice.
And then Wendy says, when ear seeds go into the ear canal, what do you suggest and where to get latex-free tape?
Oh, such a great question. So, um, this was probably the number one question moms had for me when I was putting ear seeds on their kids. So, if this happens, so first of all, your ear has little hairs that will generally prevent ear seeds from going in. So a lot of times if a little seed falls off the tape, it'll get stuck in those hairs at the entrance of the ear. But should an ear seed fall into the ear canal, I just get one of those natural earwax removal kits from Similasan, but you can use really any ones. Put the drops in the ear for like 5 or 10 minutes and then flush out with they'll have a little plunger that you can flush the ear out with warm water, and the ear seed will come right out. So 99.9% of the time, that's the best way to deal with it. It happened to me last summer. I think a crystal fell off of the outer part of the ear and went in my ear canal. And it was like, I kept feeling like something, there was like, like I was in a cave in one ear. So I did the little earwax removal trick and blink, out comes this little clear crystal. So, but I mean, I use ear seeds all the time and I've done it for many years. I think the odds of it happening to me are quite high since I use them all the time.
She had also asked where to get latex-free tape, if you happen to know that.
So I don't know about specifically where to get the tape, but I do know that earseeds.com, they all of their ear seeds are latex free and they're made in a latex free facility. And you can sign up with a wholesale account for earseeds.com and get their products. They have like refill kits, so you can get big bulk amounts of ear seeds and then get them at the wholesale price.
Gotcha. And Michelle says, let's see, I took the NADA certification in acupuncture school and learned battlefield protocol as well. And I get good feedback with that. That's amazing. Yeah.
That is amazing. I know those two protocols are solid. And if you know those work, when you can start customizing for your patients, it's like really like the results people get when they start customizing are just off the charts.
And then Ashley says, do you mind repeating example pricing for standalone ear seed treatments versus adding on ear seeds to acupuncture sessions?
Oh, that's a great question. So, standalone, it really depends on your area, where you live, your cost of doing business. I never want to tell people just like, follow, like this spectrum. Like you really have to price it out and see. But for standalone auriculotherapy treatments, they're typically between 15 to 20 minutes long, depending on what you include. Some of our practitioners include ear massage, which takes it a little bit longer and they charge more for that. But it's somewhere between 50 and 80, but we do have people charging 100 who are doing more in-depth work on the client on their ear during the session. And then for acupuncturists, they're generally raising their fees $20 to $30 or doing it as an add-on fee for between 20 and 30. Um, Again, just depends on how much. Like if you're just adding Shen Men on one ear, not, like I don't know that you necessarily need to charge a whole lot of extra for that. But if you are taking the time to examine the ear, look for the auricular signs, locate them, do pain point testing, or find reactive points with the device, it's going to take you longer and you should definitely charge more for that.
And then, so Suzanne has a related question to what you just mentioned. She asks, do you use a pointer to identify points?
So I do both. So if so there's I think patients kind of fall into three categories. They're either like hyposensitive, so you're like, does this hurt? You have your little, like the easiest way is with the probe and you're just testing for tenderness, right? Does this hurt? Is this hurt? Does this hurt? And some clients are like, yes, 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 everything hurts, right? And I have to say, when I was in the middle of really sick with mold, my whole entire ear was sore. So that was a function of how stressed my nervous system was, that everything was reactive. And then you have people on the other end of the spectrum who are like, nope, doesn't hurt, doesn't hurt, nothing hurts, nothing hurts. So this doesn't work for those patients. So in those cases, I will get out. I used to use the Pointer Plus, the Stim Plus Pro, or the Pointo Select. Those were the devices. The Pointo Select was my favorite, but it's kind of complicated to use. But it's all of them I felt like were pretty accurate. So in those cases where hyper or hyposensitivity, I would always default to using a pointer. But I think as a skill, being able to really just with a probe, be able to use pain point testing, it's faster, it's very accurate. And when done right, it can speed things up a lot faster than pulling out the devices. And it's cheap. It's just like $7 or something for a probe.
And Walter asks if CEUs are available for the certification class.
Yes, for level 1, we offer 15 CEUs, and we're going to be applying for about that same number for level 2 as well.
Perfect. And then I think we have one more question here. Yes, from Sarah. What is the age range for children and how many seeds to place at a time?
Oh, such good questions. So I just taught a class on this. So if you guys are interested, I have a class just for infants and toddlers, and then I have a class for children. So, but the answer to that question is newborns to teenagers. Everybody can use ear seeds. In fact, about 30% of the hospital's NICU units use ear seeds for their NICU babies that have neonatal abstinence syndrome or having colic or difficult to digest, because of the fact that ear seeds can regulate the autonomic nervous system. And when babies are new, they're preemies, there is a disruption in that system, and preemies have a higher tendency to later on develop neuropsychiatric disorders and things like that. So ear seeds are being used in hospitals on newborns. And they're going for it with gusto. They're actually using the whole detox, the NADA detox protocols on these preemies going through withdrawal. So they're using 5 points on each ear. And then they also, like before one of the babies gets like a heel prick or, procedure that's painful, they'll use the battlefield acupuncture pain protocol on these babies as well. So, but my general feeling for babies is less is more. So I try and limit it to 2 or 3 points. I monitor them closely for redness, swelling, or discomfort. So if they're tugging or fussy, they'll usually signal, that they don't like the ear seed, by tugging or fussing, and then you can just remove it. And then I just replace them more often if I'm noticing that there's redness, or alternate the points. There's so many good points. As you saw, that there's like 6 or 7 points just for balancing the autonomic nervous system. So you can always like use sympathetic for a couple days and then switch to 0.0 or something like that.
Perfect. And then I just wanted to remind everyone, if you have not entered your state and license number, you just want to pop that into the chat so that I can send you your free PDA credit. If you already entered it or you had to put it in when you signed up for the class, then you should be all set. But just in case, to make sure I can send you your free PDA credit. And then I believe we had one last question from Suzanne. Do you place seeds bilaterally and or alternate ears every treatment?
That's another really great question. And really, with all the research and literature I've looked through, I've seen all of it. So I've seen things like um, put the needles in one ear and seeds on the other, and then they go off with just one seed. I've seen them alternate ears with ear seeds, so they use one ear for 1 week, and the next year they use the next week. But I think the most common is bilateral, unless it's a one-sided condition. So if it's just left-sided or right-sided shoulder pain, you just do the one ear where they have the pain. But just I'm in my experience, and I'm sure you guys can relate to this, somebody comes in and it's their right shoulder that hurts, but you feel the tension on the left side is really worse in the musculature. So I often will just do bilateral treatments, as I can. And what I would often do is sometimes with acupuncture, the ear will bleed afterwards, and I don't want to just cover that up with an ear seed. So what I would often do is like use some alternate points for my ear needles, and then I would put on a slightly different protocol. So I would just do one ear with ear needles. I usually didn't do both. One ear with ear needles, and then both ear with ear seeds, and then they left the clinic with ear seeds. And I often would take a picture of their ear and show it to them. And then I would sell them a simple singles so that if the ear seeds fell off, they could just, their mom, or if it was themselves, they could just put the ear seeds back on themselves.
I love that. All right. I think we have gone through everyone's questions and people are putting their license information in the chat. So thank you very much. Um, if no one has any other questions, I just want to say thank you so much for being here. I really learned a lot today. I took lots of notes, and this was really fun. Thank you for your time.
Oh, thank you so much for having me. It's really my pleasure to share auricular therapy. As you can see, it's a huge passion of mine. So I'm happy to introduce and share people the amazing benefits of it.
Wonderful. And you've got lots of thank yous in the chat here.
Awesome.
Awesome. Well, thank you again. We will sign off. Do you want to share your email maybe in the chat in case people have questions for you, or how can they contact you?
Actually, yeah, so they can just go to robingreen@mailbox.org. And if you have any questions about the certification, when you go to earseedcertification.com, there is a little area where you can just submit questions directly to me via, you can
Beautiful.
text it to me or leave me an audio or video message, and I'll answer any questions about the program.
Amazing. All right. Well, thank you everyone so much for joining us today. We're going to sign off. Enjoy the rest of your day. Thank you, Robin.
Bye.